So dear participants, dear organizers, and dear Christos and colleagues here, it is really my honor to be here with you today, representing DG Sante and the European Commission. And I'm delighted to convey the warmest greetings and congratulations for this important event from my Commissioner, Fulvia Raffaeli, and my Director General, Sandra Gallina, who unfortunately couldn't be with us today. First and foremost, I would also like to extend my gratitude to the organizers for taking the challenge of bringing to Athens all of us for this Digital Health Week. By gathering authorities, experts, and stakeholders from across all member states, this event is playing a crucial role in advancing the European health data space. Together, we are one step closer to making this vision a reality for the EU citizens, the healthcare sector, and the European companies. The European health data space is more than just an ambitious project. It is a transformative force. It is designed to drive innovation, enhance competitiveness, and improve health outcomes. Above all, it is about strengthening the Europe vision of a human-centered healthcare sector. Yes, the EHDS is not just about tackling the needs of today. It is about shaping the future of the healthcare, promoting prevention, increasing awareness, and empowering citizens to take control of their health. Through the European health data space, patients and citizens will be able to securely access, share, and manage their health data across borders. This will ensure better continuity of care, support informed decision-making, and allow individuals to be more active participants in their own health journey. The My Health at EU cross-border digital infrastructure will connect member states, enabling patients to share their health data in a common European format, with their health traveling seamlessly across borders. This will allow for a much smoother experience when seeking care outside of their one home country. Moreover, by encouraging the safe and ethical use of health data for research and innovation, the EHDS lays the foundation for breakthroughs in treatments, personalized medicines, and quicker response to public health challenges. Citizens will directly benefit from this innovation as healthcare is increasingly tailored to their needs. The EHDS also facilitates a stronger and more connected research community. By enabling secure, interoperable cross-border data sharing, it paves the way for exciting breakthrough in diagnostic, treatment, and public health interventions. Europe's leadership in health innovation will be further enhanced as health data systems become more collaborative and efficient. I'm pleased to announce that finally, the legislative journey of the EHDS is coming to nearly to its completion. With the adoption of the Council last week and the signature ceremony planned in Strasbourg next month, we are entering now into the next phase, implementation. This implementation will occur in stages, with the general framework applying by 2029. The rollout of key infrastructure like My Health at EU for primary use and Health Data at EU for secondary use will be advanced significantly in the coming years. However, there is much of work ahead of us. Together, we will draft and adopt nearly 20 implementing acts to define the practical details of the European health data space, many of these over the next 2 years. We will also build the infrastructure that will make sure an interoperable data sharing a reality. And additionally, we will also define the rules and set up the EHDS board and stakeholder forum to guide governance and ensure effective oversight. This is a collective effort, not a top-down project. It requires your expertise, your ideas, and your political support. This is what we learned from the success of the European Digital COVID Certificate. When we work together, we can achieve remarkable things. Let's take a moment to consider the opportunity the EHDS presents. It is not about compliance. It is about creating value. New market, innovative services, and AI-driven tools are poised to flourish, from diagnostic and treatment personalization to transformative public health interventions. The EHDS will enable Europe to lead the way. For example, look at the potential for advancing cancer imaging. The Xt-EHR project is focused on improving the quality of cancer images and data across Europe. And the EHDS, particularly through the health data at EU infrastructure, will play a critical role in facilitating the discoverability and accessibility of this data, enabling the development and validation of AI models that can revolutionize cancer care. A new project, Shaped, set to launch in March, will test AI models using the health data at EU infrastructure. One of the key focus areas will be cancer imaging, making a groundbreaking collaboration between Xt-EHR and the EHDS. And the partnership showcases how the EHDS can catalyze innovation and bring enhanced outcomes for patients across Europe, especially in the fight against cancer. But let me now focus briefly on the technical but vital work of the joint action, which is responsible for preparing implementation guides, technical specification, and a conformity assessment framework for the European Electronic Health Record Exchange format. This format, covering patient summaries, electronic prescriptions, medical images, and more, will ensure seamless integration into electronic health records solutions across the European digital single market. The European Electronic Health Record Exchange format will be the common technical language that drives the EHDS forward. It is critical for supporting innovative health systems such as telemedicine and mobile health, and will strengthen Europe's digital health ecosystem. And here, let me be very clear. The Commission expects the joint actions, but also from the other project deliverables, to provide not only the necessary framework, but also precise technical specification that will guide the future implementing acts of the European health data space. Addressing interoperability, security, and usability challenges is essential to ensure that member states and vendors are prepared for the regulations that will come into force in just over 4 years. Investing in the joint action and in its related project is the best way for all stakeholders to prepare for the obligation of the EHDS and to ensure that we create a patient-centered, connected healthcare system across Europe. The European Commission, of course, plays a key role in supporting the EHDS implementation, providing substantial funding initiatives that enable the development of essential digital health infrastructures, core border services, and interoperability solutions. And in the presentation just after me from Adea, we'll share, we'll know more about these new funding mechanisms that are accelerating progress in enhancing healthcare across the EU. Let me now conclude and repeat again that the EHDS is not just an IT project or a regulatory framework. It is Europe's gateway to health innovation. By creating a secure and interoperable environment for health data sharing, we are empowering researchers, industry leads, and policymakers to collaborate like never before. It is, even more important, our European way to take care of the one we love. And together, we will make it. We will make of the EHDS a reality. Thank you very much.